Yeah, I remember you had that extra variable of, I mean, your daughter was what, just a few months old when this, you know, immature immune system, and not to minimize the fears we had, and, you know, what I said. I remember you saying, I just feel like I shouldn't hold her.
Yeah, you work a lot, and you try to spend a lot of time at home when you can, and it was the first time I was reminded how important I was to the people who cared about me. My kids and my wife, work really hard so that I can be here when I need to be here. And, when my daughter, she's young, she's only a year old now, would sort of call out for me, my little ones would remind her that, he'll be home soon. Somebody needs him more today, and I hope I get that time back. I very much was alone. I lived in a different part of the house. I came in late. I left early, and they allowed me, because of all of their support, they allowed me to do what I needed to do, to be here and to take care of people who needed me more than they did. So I'm really grateful for that.
It's always very all-encompassing, being an intensive care provider. But to some extent, it was easier to sort of isolate that and leave work at work, which I'm never very good at. But now with this, it's impacting everything in your life. I mean, you can't forget about COVID, because when you go home, I'm homeschooling my husband is homeschooling my second grader.
Yeah, you and I talk about, leaving work at work all the time, being there for your family, and getting the most out of your time. You couldn't do it. You couldn't leave work at work. It was hard to detach and maybe, focus on family when you were doing COVID 24/7.
Yeah, and the first time it was like a personal threat to your family, like that your livelihood was actually potentially a personal threat.
Yeah, you think about bringing the virus home, but some of the things that could be more detrimental is bringing the frustrations of the job home. My kids know more about COVID and critical care than any 5 or 8 or 1-year-old probably should, and then having any of that pressure bleed over into otherwise normal interactions with a spouse or a child was tough.